How coronavirus affects your sense of taste and smell. UK researchers have suggested that a loss of taste or smell could be a sign of coronavirus. By mapping the symptoms of over 400,000 people through an app, the researchers of King's College London discovered a high rate of deadened senses among those suspected of having the virus. Hot fever, losing your sense of smell and taste, is a common symptom of other respiratory infections, such as flu or even the common cold. The fever and continuous cough are still the most important symptoms of coronavirus to look out for. If you find yourself unable to taste your food, it doesn't automatically mean you have the disease. It may be down to a common sniffle. 53% of the respondent reported that they had fatigue or tiredness, 29% had a persistent cough, 28% had a shortness of breath, and 18% had a loss of taste or smell. Crucially, of the 400,000 people, only 1,702 said that they had been tested for COVID-19, and of those, only 579 had a positive result. When just looking at these 579 people, 59% reported a loss of smell or taste. The World Health Organization and Public Health England have not added this loss of sense to the list of coronavirus symptoms yet. But experts are hoping that looking at this alongside other symptoms will help to refine the identification of the illness that has spread across the globe. Lead researcher, Professor Time Spector says, when combined with other symptoms, people with loss of smell and taste appear to be 3 times more likely to have contracted COVID-19 according to our data. As always, you can check the Government THB site and your own staying area coverage of the coronavirus outbreak to keep up to date with the latest guidelines and keep yourself safe. How viruses like the coronavirus can steal our sense of smell. When you catch a severe cold, your nose stuffs up, you can't smell anything, and food tastes funny. Fortunately, most people regain their sense of smell once the cold runs its course. But for others, the complete anosmia or partial hyposmia loss of the sense of smell is permanent. Referring to Zara Patel, MD, a Stanford associate professor of otolaryngology, head and neck surgery, and director of endoscopic skull-base surgery, to learn more about her research on olfactory disorders. In particular of her recent study on the possible association between postviral olfactory loss and other cranial neuropathies, which are disorders that impair your nerves and ultimately your ability to feel or move. She also described how her work pertains to the COVID-19 pandemic. She is part of an international consortium of scientists, clinicians and technicians investigating the possible effects of the disease on smell and taste. She encourages anyone who has recently experienced symptoms of respiratory illness to fill out a survey being used by the consortium. How does a virus impair someone's sense of smell? A variety of viruses can attack the cranial nerves related to smell or the mucosal tissue that surrounds those nerves. Cranial nerves control things in our head and neck, such as the nerves that allow us to speak by using our vocal cords, control our facial motion, hear and smell. For example, COVID-19 is just one type of disease caused by a coronavirus. There are many other types of coronaviruses that cause colds and upper respiratory illnesses, as well as rhinoviruses and influenza viruses. Any of these viruses are known to cause inflammation, either directly around the nerve in the nasal lining or within the nerve itself. When the nerve is either surrounded by inflammatory molecules or has a lot of inflammation within the nerve cell body, it cannot function correctly, and that is what causes the loss or dysfunction of smell. And it can happen to anyone, young and old, healthy and sick. How did your study investigate olfactory loss? In her practice, she sees patients who have smell dysfunction. But she is also a sinus and skull-base surgeon, so she has a whole host of other patients with sinus problems and skull-base tumors who don't have an olfactory loss. So she did a case control study to compare the incidence of cranial neuropathies, conditions in which nerves in the brain or brainstem are damaged, in 2 patient groups. 91 patients had postviral olfactory loss and 100 their controls, and they matched as closely as possible for age and gender. They also looked at family history of neurologic diseases, such as Alzheimer's disease, Parkinson's disease and stroke. What did she found? Patients with olfactory loss had 6 times higher odds of having other cranial neuropathies than the control group, with an incidence rate of other cranial nerve deficits of 11% and 2%, respectively. Family history of neurologic diseases was associated with more than 2-fold greater odds of having a cranial nerve deficit. Although they had a small sample size, the striking difference between the groups implies that it is worthwhile to research this with a larger population. Our findings suggest that patients experiencing these pathologies may have inherent vulnerabilities to neural damage or decreased ability of nerve recovery, something beyond known risk factors like age, body mass index, comorbidities, and the duration of the loss before intervention. For example, there may be a genetic predisposition, but that is just an untested theory at this point. How does this work pertain to COVID-19? Smell loss can be one of the earliest signs of a COVID-19 infection. It can sometimes be the only sign. Or it can present after other symptoms. Although it may not affect every patient with COVID-19, loss of smell and taste is definitely associated with the disease. In some countries, including France, they've used this as a triage mechanism. People need to know that these symptoms can be related to the COVID-19 disease process so they aren't going about their lives like normal and spreading the virus. The pandemic also might impact how they treat patients with olfactory dysfunction in general. When someone has a viral-induced inflammation of the nerve, they sometimes treat it with steroids to decrease the inflammation. But treating COVID-19 patients with steroids might be a bad idea because of its effect on the inflammatory processes going on in their heart and lungs. What advice do you have for people who have an impaired sense of smell? First, if you lose your sense of smell and it isn't coming back after all the other symptoms have gone away, seek care as soon as possible. If you wait too long, there is much less that they can do to help you. Interventions, including olfactory training and medications, are more effective when you are treated early. Second, if you lose your sense of smell or taste during this pandemic and you don't have any other symptoms, contact your doctor. The doctor can decide whether you need to be tested for COVID-19 or whether you need to self-isolate to avoid being a vector of the virus in your family or community. Sudden loss of taste and smell should be part of COVID-19 screen as evidence piles up documenting a sudden loss of smell and/or taste as a presenting symptom of COVID-19. The call to screen for these phenomena is growing. A number of new publications show a high proportion of people infected with COVID-19 report loss of smell and/or taste, with their authors adding to the clamor to recognize these symptoms as potentially indicative of the infection. In particular, there is a belief that these signs may be present in many with asymptomatic COVID-19. And therefore asking about them could be a way to prioritize people for initial testing for the SARS-CoV-2 virus in the absence of other symptoms. Anyone testing positive could then quarantine, and their contacts could be traced. Despite this, the World Health Organization (WHO) has not listed loss of smell or taste as potential symptoms of SARS-CoV-2 infection. But the U.S. Centers for Disease Control and Prevention (CDC) has now added new loss of taste or smell as a symptom on its COVID-19 information page. American Academy of Otolaryngology, Head and Neck Surgery Executive Vice President and CEO James C. Denneny III, 1500th, believes the symptoms may be an early warning signal. And there's no downside to checking for these, Denneny told Medscape Medical News. Denneny says, given the fact that this doesn't require any surgical procedure, biopsy, or specific treatment, I think the upside of getting it early is great. The downside of using it as a symptom, and if someone doesn't turn out to have it, is virtually zero. Claire Hopkins, MD, president of the British Rhinological Society, and colleagues, writing in Lancet Infectious Diseases, agree. Physicians evaluating patients with acute onset loss of smell or taste, particularly in the context of a patent nasal airway, should have a high index of suspicion for concomitant SARS-CoV-2 infection. They also observe that this appears to occur, in contrast to other respiratory infections, in the absence of nasal congestion or rhinorrhea. And newest publications find smell and taste loss as common. Author of one of the newly published studies, Carol H. Yan, MD, an otolaryngologist and head and neck surgeon at the University of California, San Diego, also thinks that sudden smell and taste loss seem to be fairly specific markers of COVID-19. In her survey of patients who presented to UC San Diego Health for SARS-CoV-2 testing, Yan and colleagues reported that 68% 40 of 59 of COVID-19 positive patients reported olfactory impairment and 71% 42 of 59 reported taste impairment. Among the 203 people in the control group who were PCR negative for SARS-CoV-2, just 16% had smell loss and 17% had taste loss, according to their results published in the International Forum of Allergy and Rhinology. According to MD Yan, based on their study, if you have smell and taste loss, you are more than 10 times more likely to have COVID-19 infection than other causes of infection. The most common first sign of a COVID-19 infection remains fever, but fatigue and loss of smell and taste follow as other very common initial symptoms. They know COVID-19 is an extremely contagious virus. This study supports the need to be aware of smell and taste loss as early signs of COVID-19. Yan told Medscape Medical News that another not yet published analysis indicates that sudden loss of smell or taste may be more representative of a mild form of disease. She urged, getting these people tested and isolated could therefore help prevent spread of COVID-19. She also explained, based on Yan's report and other case reports, the UC San Diego Health System is now asking all callers to its COVID-19 hotlines, and all visitors and staff, if they've had a sudden loss of taste or smell in the last few weeks. And Ahmad R. Sedigat, MD, PhD, at the University of Cincinnati, Ohio, takes a similar view. In a new systematic review of the topic published April 14 in Laryngoscope Investigative Otolaryngology, Sedigat and colleagues says, anosmia, total loss of smell without nasal obstruction, in particular, appears to be a highly specific indicator of COVID-19. Sedigat says a sudden loss of sense of smell wouldn't necessarily lead people to think they have COVID-19, particularly if they remain asymptomatic, so these individuals could continue business as usual and spread the disease as a carrier. According to him, if someone experiences anosmia without nasal obstruction, aside from quarantining, it would not be unreasonable to reach out to one's primary care physician about getting tested. Symptom checkers add weight. Several organizations around the world have begun collecting symptom reports from patients and clinicians, which has shown more light on the sudden loss of taste and smell as potential flags for COVID-19. In an April 14 Morbidity and Mortality Weekly report from the CDC on COVID-19 infections in healthcare workers, of the 5,000 who reported symptoms, 750, 16%, wrote loss of smell or taste as an other symptom. Meanwhile, the COVID Symptom Tracker smartphone app, a joint effort by Massachusetts General Hospital, Boston, Stanford University, California, and King's College, London, UK, which as of press time, was monitoring some 2.5 million people, has had similar findings. In a preprint publication on 400,000 people reporting one or more symptoms between March 24 and 29 on the tracker, 18% had lost their sense of smell or taste. More than the 10% who reported fever, but far less than the 53% who reported fatigue. Only 1,702 of the 400,000 had received a COVID-19 test. Of those, 579 had tested positive and 1,123 were negative. The organizers estimated that of those who were positive, 59% reported losing smell or taste, compared with just 18% who tested negative. Tim Spector, MD, a genetic epidemiologist at King's College and the app's lead researcher, says on the Symptom Tracker's website, when combined with other symptoms, people with loss of smell and taste appear to be 3 times more likely to have contracted COVID-19 according to their data. He urged these people should therefore self-isolate for 7 days to reduce the spread of the disease. Anosmia is the initial symptom in many patients with COVID-19. The AOHNS also began collecting data from physicians and patients on March 25 through its web-based 16-question symptom tracking tool. It has received more than 500 reports of sudden taste or smell loss, said Denany. In a report on the first 237 responses, published in Otolaryngology Head and Neck Surgery, anosmia, profound loss of smell, was found in 73% of subjects before a COVID-19 diagnosis and was the initial symptom in 27% of those subjects. That latter determination was the single most important finding, said Denany, noting it shows that smell and taste loss are a sentinel symptom. Anosmia led to testing in only 40% of the cases. Half of the reports came from otolaryngologists, but a large number came from other medical specialties, especially from family medicine. Just 2% of reports came from patients in that first group, which was based on responses through April 3. Deneny said that more reports are now coming in from patients, which he attributes to widespread media coverage about the loss of taste and smell. It's still not entirely clear why SARS-CoV-2 might inhibit taste or smell. More common viruses like influenza and other coronaviruses can also cause smell and taste loss. So far, it seems like the sensory recovery is faster for SARS-CoV-2 than the other viruses, which suggests a potentially different mechanism of action, said Yan. Patients she surveyed at UC San Diego recovered the senses within a few weeks to a month, compared to months or a year with the more common viruses. Yan's study was partially supported by the National Institutes of Health.